for further evaluation. More important is, when you look at the biophysical profile and the patient has been shifted from the labor room, you should know what is the first parameter which will disappear. Because if you know that, you know how bad the fetus is. And the point here is that the fetal heart rate and the fetal breathing movement are the first to be affected as the fetus starts going into hypoxia and acidemia. But fetal heart rate you already know because the NST is flat. So what should be the first thing you do when the fetus comes into the room? You look for the fetal breathing movement. That's the first parameter you need to get in. And if you have documented that, you actually basically have a good fetus. The fetal movement and fetal tone are affected later and they actually signal a much worse prognosis because now this fetus is going beyond the points and chances of recovery. There is somebody who says sometimes that you could do a modified biophysical score. That means you don't do the entire score. You don't do a 20-minute scan and try to look at fetal breathing movements. You just find out if the NST is fine or the amniotic fluid assessment is fine. This can be done actually with a portable machine in the labor room. But if you want to do more, then you need to send the patient into the ultrasound department. Now when I started, I said for each of the 5 biophysical variables, you will score 2 points. Earlier, there was a criteria which actually gave 1 point for a certain parameter. For example, there are only 2 movements and not 3 movements in a period of 30 minutes. You give 1 point or 1 score. That is not there now. Now it's very clear. Either you give 0 points or you give 2 points for every parameter. Which means your total is always going to be even. Either you will have a 2 by 10 or a 4 by 10 or a 8 by 10 biophysical score. You will never have a 7 because they are not using it anymore. The non-stress test and the fetal breathing movements. Just imagine you already have 2 parameters which are going down. When they are suppressed, the pH has already gone below 7.2. So you actually have fetal acidemia if your fetal breathing movement has gone down. Worse will happen if the fetal pH actually is about 7.1, then fetal tone and movements will also abolish. That is why this plays a role with Doppler in fetal well-being studies in around the 3rd trimester. Okay, you have a picture here. It's a static picture taken from the fetus straight away. And if I ask any one of you right away, is this fetus having tone? Would you say yes or no? Yes, because normally a fetus with tone will maintain an attitude of flexion. Everything here points to the fetus having an attitude of flexion. If this fetus had no tone, then what would have happened to the spine? The spine actually would have straightened out because it cannot hold itself in the cramped position. So actually if somebody shows you a static picture of fetus, you can very clearly say that yes, this fetus has got tone. What about this? This fetus has tone or no? Yes, because the hand is clenched, and that is important because if a fetus is not having tone, then the hand actually will open up because it doesn't have the strength to keep the grip on itself. Of course, if you have a cooperative fetus, then you actually might have almost a picture like this, where you can see that classical opening and closing of the hand as they had initially described by Manning and all. What about the movements? Look at spinal movements by trying to keep the spinal towards the probe. Once you keep them over there, you actually can essentially try and see that there will always be some amount of flexion and extension abilities of the fetus which can be admired. Fetal breathing movements. The present criteria I told you, duration does not matter, presence of breathing is enough. Where do you want to record it? You want to record it slightly paraspinal, keeping the probe in a way that you can see little bit of the thorax. This is the hyperechoic lung and the little bit of liver, and liver is generally hypoechoic. So between a hyperechoic lung and a hypoechoic liver, you have slight thin hypoechoic line, and that is the diaphragm. Get your section there and wait. After some time the fetus is going to take a breath, and when it breathes, this is how you are going to see, and that's enough. You give 2 points, the score is over. Now a lot of people say, I don't want to do a biophysical profile because it takes 20-30 minutes. You don't need 20-30 minutes. If you have seen all the parameters in the first 5 minutes, your score is already 10 by 10 and you send the patient home. What about if the spine is anterior? This is a very frequent complaint that if the spine is anterior, it actually becomes difficult to say whether the fetus is having any breathing or not. This picture actually shows it slightly better, that if you still observe, you will see the discrepancy between the lung and the abdomen. The abdomen goes in, the lung comes out, and you can still comment on the fetal breathing movements. I don't want to talk about Leica. There was a dedicated talk on Leica, but basically remember this: when you measure Leica, the probe has to be absolutely parallel to the bed and not to the abdomen of the mother, because the abdomen is going to have a contour. You don't have to angulate your probe to try and increase the length of your pocket. No, you need to keep it bang in one of the quadrants, straight down, and then measure what it is there. Don't try to increase or decrease the pocket. And go to 4 sides, add them up, and you get an amniotic fluid index. Now, if you have a 4-quadrant ability on your equipment, it's actually very easy, because you immediately put your 4 quadrants, you add them up, and you find out what is the total number. And make sure you don't include the pockets where you have the fetal parts or you have umbilical cords. They are not a part of the amniotic fluid index. But for biophysical profile, this is enough. One pocket, 2 centimeters in length, 2 centimeters in width, 2 points given. Very important to remember that this fetus still may have oligohydramnios, because if you do a 4-quadrant study and your AFI is 4, it is oligohydramnios. But you have one pocket which is 2 by 2, it is full scores for biophysical profile. This difference has to be remembered, that you can have oligohydramnios but a normal biophysical profile. Okay, always use color to rule out the presence of cord, because sometimes you will measure this as 2 centimeters and then you realize actually it was occupied by the cord. If the cord is there, we are not including this. I will end with some of the frequently asked questions on BPP in all the seminars where you go. Does fetal state play a role in BPP? Fetal state means, is the baby sleeping or not? So does it play a role? Does it matter? Yes or no? It matters. It actually really does matter. It matters if the baby is sleeping or not, because if the baby is sleeping, then it's going to breathe so slowly that you actually may even think that you are having no fetal breathing movement, and you might score 0. So if you have a bad biophysical profile, actually there are 2-3 things people advise. One, they say give the mother some chocolate, because she goes into hyperglycemia, baby starts moving. 2, you can use vibroacoustic stimulation. You can keep it on the abdomen. It makes this funny sound and vibrates the abdomen for a few seconds, the baby wakes up. Or the third and the easiest is, let the lady go out for a walk. She comes after 5 minutes, baby usually are woken up. This is just one of the journal articles which also explain the same, that if it's in a quiet sleep of state 1, then almost 44% fetuses failed to achieve a normal biophysical profile score. So just imagine that you need babies who are active when you want to do BPP. Then it depends upon what the mother is having. We don't have many of the problems of the West, and that's why I think we all are blessed people, because the West has a lot of problems. What happens if you have alcohol? If the woman is an alcoholic, then you have factors which actually decrease fetal breathing movement. And these are all exterior factors on which you don't have control, but you need to take a history and find out if they are affecting. Or if she's any kind of drugs, terbutaline, theophylline, they can also increase fetal breathing movements. Can fetal hiccups be counted as fetal breathing movements? Because you know that many times when you scan, you don't see the fetal breathing movement, you see jerkiness of the diaphragm. You know the fetus is having hiccups. What should you do? Should you wait for normal breathing movement to come? Yes, no? No, it is yes. You have to count. The moment you have a fetal hiccup, you say yes, give 2 points, move ahead. And why? Because if you notice the way the entire system works, which actually stimulates the diaphragm in breathing, the hiccup and the breathing movement go through the same cortical center, the respiratory center, go via the phrenic nerve to the diaphragm to stimulate it. So if you see a hiccup, give 2 points, move ahead, don't waste your time. Some people ask what are the fetal movements look for, limb extensions, arching of spines, open and closing, and we've already discussed this. This answer you know, because all of you said yes when I showed you the static image. If the fetus is absolutely having a flexion position, then we know it's going to be a fetus which has good tone. Hypotonia, a fetus which has less tone, apart from what I said, has things like drooping wrist. A drooping wrist is not a clenched wrist flexed at the wrist opens up. Then a partially open placid hand. That is important. It's called a policeman tip hand, and we know in both the countries it works. How does a policeman take tip from you? Like this. That's what happens to the fetus's hand. When it loses its tone, it just falls down like this, and it's called a policeman tip hand because it's opened up backwards. Then the spine goes into a neutral position, straightens out. 3. Fetus sinks in the amniotic fluid. Doesn't have strength to float. And even if you move by your ultrasound probe, it has jerkiness. It goes up and sinks back. It is a fetus which has no tone. That is very, very important. Another interesting question. From what gestation age is the biophysical profile reliable? Now you have to remember that one component of your biophysical profile is the fetal cardia, the non-stress test. That only becomes reliable after 32 weeks. So to include that, you need to do it after 32 weeks. But if you don't include that, you will realize that most of the other parameters become fairly active by around 17 to 18 weeks. So at the end of second trimester, you can do a sonologically limited biophysical profile score and score out of 8 because you are not giving points for the NST. So you give 8 out of 8 or 6 out of 8 as you wish. What percentage are normal? Most of them are normal. 97 percentile you are going to have normal BPPs, which means that's the least of your worries. The abnormal scans are going to be very, very small in number. This is very simple. Is there a correlation between biophysical profile and perinatal mortality? Yes, there is. The moment the score keeps going down, perinatal mortality keeps going up to an extent that you start losing fetuses pretty early. Is it reliable with polyhydramnios? The interesting thing is that polyhydramnios does not affect acute variables. What are the acute variables? Acute variables are like these fetal breathing movements, fetal tone, NST, they are not affected. So you can still give 2 points and not worry because this is most probably a chronic problem. Liker is a chronic problem, fetal breathing movement is acute problem, fetal heart rate is acute problem, fetal tone is acute problem. So those are the parameters which are more dangerous and they need to be there. They are also all neurological problems, which means they are telling you what is happening to the neural centers, and if hypoxia occurs, those are the centers which will get affected first. What happens if you have oligohydramnios? Because there has been a rupture of membrane. It is again reliable because again most probably you have chronic problems. Liker is a chronic problem, it will not affect the acute variables. But if your biophysical profile is 6/10, then you know that you lost 2 points because of Liker and you lost 2 more points because other variable went down and you have to become concerned. This is a very interesting thing that presence of fetal breathing movements has the highest specificity in predicting an absence of fetal infection, especially in cases where there has been an ROM. Okay, is it reliable in presence of fetal anomalies? It depends what kind of anomaly. If you have a club foot, it is not going to affect your biophysical profile. It is going to be absolutely normal. But if you have a diaphragmatic hernia, then you might have difficulty. Fetus is having difficulty in showing breathing movements. So your BPP can be affected. You need to just keep that in your mind in the background. This is the most important slide because in the evening at 7 p.m. you can give a normal biophysical profile score and you can still lose the fetus by midnight. And early morning, the gynecologist can call you and say that, you know, you did a very stupid scan because you said everything was fine and still I lost the baby. The reason is simple, because there are a lot of things it cannot evaluate. Cannot evaluate feto-maternal hemorrhage suddenly, vasa previas, cord entanglements, abruptio placenta, cord